People who are infected with COVID-19 usually having difficulty in breathing due to the lung abnormalities, meaning there are presence of SARS-CoV-2 in the patient lung. By detecting the presence of the virus in the patient lung, we can know whether the patient is infected with COVID-19 or not to prevent the spreading of the virus towards the public. Stay tuned for more info. Assalamualaikum, I'm Noor Sakinah, final year medical physics students at University Science Malaysia, and this video was dedicated for physics of medical imaging subject. Chest imaging has been considered as part of diagnostic workup of patients suspected with COVID-19 disease, where RT-PCR test is not available. Besides, based on research in 2020, PCR test has at least 30% of false negative rate. Thus, chest imaging has been considered to complement clinical evaluation and laboratory parameters of patients diagnosed with COVID-19 disease. There are a few imaging techniques used for imaging COVID-19. As for now, the most commonly used imaging technique was MRI, CT scan, and X-ray. However, in this video, we will be focusing on MRI and CT scan and comparison between both for diagnosing COVID-19. So, what is MRI and CT scan? MRI or magnetic resonance imaging uses a large magnet, radio waves, and a computer to create a detailed cross-sectional image of internal organs and structures. Meanwhile, CT scans emit a series of narrow beams through the human body as it moves through an arc. The data is transmitted to a computer and which builds up a 3D cross-sectional image of the picture of the part of the body and displays it on the screen. Generally, the CT scan and MRI were used clinically in different cases. As for CT scan, it creates a 3D image used primarily to diagnose condition in organs and soft tissues, more powerful than an X-ray, and it takes a 360-degree images. On the other hand, MRI also creates a 3D images used primarily to scan the spine, brain, breast, muscles, abdomen, and neck, and it uses powerful magnet and radio waves and create cross-sectional images. Moving on, how MRI and CT scan detect COVID-19. As for CT scan, the chest CT gives a much more detailed view if we compare to chest X-ray. The most common CT finding in COVID-19 are those ground glass opacities scattered to the lungs. They represent tiny air sacs or alveoli getting filled with fluid and turning a shade of grey on a CT scan. In severe or more advanced infections, more and more fluid will accumulate in the loops of the lungs. So, the ground glass appearance will progress to a solid white consolidations. Finally, there's a finding called the crazy paving pattern due to swelling of the interstitial space along the walls of the lung lobules. This makes the walls look thicker, like white lines against the hazy ground glass background. The appearance is similar to irregular shaped stones used to pave a street, hence the name crazy paving. And these three the CT findings: ground glass opacities, consolidations, and crazy paving patterns can be seen in isolation or in combination with one another. How about MRI scan? MRI scan detected presence of SARS-CoV-2 by the presence of ground glass opacities and crazy paving, same as explained in CT scan. However, Due to high airness of the pulmonary tissue, fewer water molecules form a signal, which is inevitable reduces the signal-to-noise ratio, thus resulting in poor quality images. How do we know which is better, MRI or CT scan? First, we need to compare between both MRI and CT scan. As for CT scan, it uses ionizing radiation. This ionizing radiation during CT studies causes concern for patients who require dynamic observations, as well as examination of children and young people. As for MRI, it uses non-ionizing radiations, thus very less severe effects towards the skin compared to the CT scan. Second, CT scan creates a clearer image resolution due to the use of X-rays. Meanwhile, MRI method of visualizations of the lungs have several disadvantages. In addition, susceptibility effects leads to even more pronounced signal attenuation. MRI has low anatomic resolution and is compromised by inevitable artifacts due to breathing movement. The third one is CT scan is better than MRI in terms of diagnosing COVID-19 because it does not use powerful magnets and radio waves. However, for MRI, due to high airness of the pulmonary tissue, fewer water molecules form a signal, which is inevitably reduces to the signal-to-noise ratio, resulting in poor quality images. Thus, it creates unclear image of the chest imaging. So, what are the similarities of CT scan and MRI? The similarities between CT scan and MRI was the crazy paving signs on chest imaging. On CT scan and MRI scans were visually identical. Hence, we concluded, which is better, MRI or CT scan? Based on WHO 2021 Clinically Radiology Imaging, poor results shows that the chest CT correctly diagnosing COVID-19 in 80.6% of people who are COVID-19. However, it incorrectly identified COVID-19 in 28.5% of people who did not have COVID-19. Chest imaging is sensitive for severe cases of COVID-19, but it does not specific for COVID itself. The evidence suggests that chest imaging is better at ruling COVID-19 infections than distinguishing it for other respiratory problems. So, its usefulness may be limited to excluding COVID-19 infection rather than distinguishing it from other causes of lung infection. To add on, in case of CT is not available, it is advisable to conduct a chest MRI for patients with suspected or confirmed COVID-19. That's all from this video. I'm Noor Sakinah. Thank you for watching my video.